Welcome to Pinoy Medical Coder. Today, we'll discuss about medical coding related to COVID-19. Before we begin, please don't forget to like our Facebook page and like and subscribe to our YouTube channel. Medical coding related to COVID-19, or coronavirus disease 2019, is an evolving area, including new CPT, HCPCS Level 2, and ICD-10-CM codes with varying effective dates. Payers, such as Medicare and Medicaid, are also releasing billing and coding guidance for services related to COVID-19. Healthcare organizations, and medical coders in particular, need a strategy for staying up to date to ensure proper reporting for testing, treatment, and diagnoses as the situation changes. The information below summarizes the updates to streamline your research on COVID-19 coding. Terminology: COVID-19 and SARS-CoV-2. COVID-19 is the name for an infectious disease that most commonly causes fever, tiredness, and a dry cough, according to the World Health Organization, WHO. Most people do not require special treatment to recover from COVID-19. But older people and those with underlying medical problems are more prone to serious illness that involves difficulty breathing. On March 11, 2020, WHO characterized COVID-19 as a pandemic, meaning the worldwide spread of a new disease. The term pandemic does not refer to the threat level involved. COVID-19 is caused by a virus named Severe Acute Respiratory Syndrome Coronavirus 2. SARS-CoV-2, states the Centers for Disease Control and Prevention, CDC. SARS-CoV-2 and the virus that caused the 2003 outbreak of SARS are genetically related, but the diseases are different. Medical code descriptors and guidance may use terms related to COVID-19 or SARS-CoV-2, so you need to watch for both to avoid missing a relevant code or instruction. CPT code for SARS-CoV-2 or COVID-19 testing. The American Medical Association, AMA, CPT editorial panel has approved a new COVID-19 test code, 87635, infectious agent detection by nucleic acid, DNA or RNA, severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, coronavirus disease, COVID-19. Amplified probe technique. A publicly available CPT Assistant Special Edition about 87635 provides guidance on proper use of the new code. Here are some examples. The AMA published the new code on March 13, 2020, and the code is effective immediately. Healthcare organizations should check third-party payer policy on retroactive billing and reimbursement. Some payers may require use of a HCPCS Level 2 code instead of 87635. Labs should follow the guidelines for microbiology codes that state when performing separate assays on multiple specimens, append modifier 59, distinct procedural service. For instance, if a lab tests an esophageal specimen and a separate oropharyngeal specimen, it may be appropriate to report 87635, 87635-59 HCPCS Level 2 codes for SARS-CoV-2/COVID-19 testing. 2 HCPCS Level 2 codes for COVID-19 testing have an implementation date of April 1, 2020, which is when Medicare claims processing systems will be able to accept the codes. Dates of service can go back to February 4, 2020. Private payers may accept these codes, as well, so healthcare organizations that report these tests should confirm payer preference. According to the April 2020 file on the Centers for Medicare and Medicaid Services, CMS, HCPCS quarterly update page, these are the descriptors for the new codes. U0001, CDC 2019 Novel Coronavirus, 2019 nCoV, Real-Time RT-PCR Diagnostic Panel. U0002 2019 nCoV Coronavirus, SARS-CoV-2 or 2019 nCoV, COVID-19, any technique, multiple types or subtypes, includes all targets, non-CDC. Code U0001 is appropriate for the use of tests developed by the CDC. Code U0002 will allow labs to bill for non-CDC tests. CMS has released a document with test pricing for U0001 and U0002. For U0001, CDC tests, the test prices listed are $35.91 or $35.92, depending on the Medicare Administrative Contractor, MAC, jurisdiction. The U0002 test prices listed are $51.31 or $51.33. ICD-10-CM code for COVID-19, effective April 1, 2020. In January 2020, WHO established a new ICD-10 code, U07.1, 2019 nCoV acute respiratory disease. The organization acknowledged that the disease name was likely to change, which it later did to COVID-19. ICD-10-CM is the United States clinical modification of ICD-10. The code sets are not identical, but the CDC has announced that a new ICD-10-CM code will be effective April 1, 2020, U07.1 COVID-19. The original plan was for the code to have an effective date of October 1, 2020, but the CDC changed the date to April 1, 2020, to assist with claims and surveillance data. This news comes from the CDC because the CDC National Center for Health Statistics is the federal agency responsible for use of ICD-10 in the U.S. The agency is one of the 4 cooperating parties for ICD-10-CM, along with CMS, the American Hospital Association, and the American Health Information Management Association. The new COVID-19 diagnosis code, descriptor, and related addenda were included in the agenda and meeting proposal for the March 2020 ICD-10 Coordination and Maintenance Committee meeting. ICD-10-CM coding for COVID-19 before April 1, 2020. The CDC has provided official interim diagnosis coding guidance to assist with proper reporting before the ICD-10-CM code for COVID-19 is effective. This guidance is posted on the CDC's National Center for Health Statistics ICD-10-CM page. Table 1 summarizes this interim coding guidance, which has an effective date of February 20, 2020. Healthcare organizations should use this guidance in conjunction with the 2020 ICD-10-CM official guidelines. Note that the guidance states B34.2 coronavirus infection, unspecified, which is part of category B34, viral infection of unspecified site, would generally not be appropriate for the COVID-19, because the cases have universally been respiratory in nature, so the site would not be unspecified. Confirmed cases: pneumonia due to COVID-19, J12.89, other viral pneumonia and B97.29, other coronavirus as the cause of diseases classified elsewhere. Acute bronchitis due to COVID-19, J20.8, acute bronchitis due to other specified organisms, and B97.29. Bronchitis not otherwise specified, NOS, due to COVID-19, J40 bronchitis, not specified as acute or chronic, and B97.29. Lower or acute respiratory infection NOS associated with COVID-19, J22, unspecified acute lower respiratory infection, and B97.29. Respiratory infection NOS associated with COVID-19, J98.8, other specified respiratory disorders, and B97.29. Acute respiratory distress syndrome, ARDS, that develops with COVID-19, JAD, acute respiratory distress syndrome, and B97.29. Exposure to COVID-19. Concern about possible exposure, ruled out by evaluation, Z03.818. Encounter for observation for suspected exposure to other biological agents ruled out. Exposure confirmed, Z20.828. Contact with and suspected exposure to other viral communicable diseases. Signs and symptoms without definitive diagnosis. Cough, R05. Shortness of breath, R06.02. Fever, R50.9. Medicare and Medicaid coverage in news. CMS Current Emergencies page provides links to a long list of resources under the header Coronavirus. Healthcare professionals in a variety of roles will find helpful information here. For instance, the Clinician and Technical Guidance section offers documents about infection control in nursing homes, home health, hospice, and dialysis facilities. Other examples include links related to protective mask use, blanket waivers, and telehealth benefits. The page also includes a billing and coding guidance category, which features fact sheets on coverage and payment, and a COVID-19 facts document that answers questions like does Medicare pay for a doctor or non-physician practitioner, NPP, to furnish care in a beneficiary's home. The fact covers issues relevant to hospital services, vaccinations, and ambulance services, as well. As you review the CMS page, you should check the date next to each link to be sure you're applying the latest guidance. Keep in mind that COVID-19 information likely will move from this current emergencies site in the future. For providers who report to Medicaid, National Medicaid's COVID-19 page is a good starting point for research. The Medicaid page includes targeted advice, such as a fact sheet on Medicaid coverage and benefits related to COVID-19 and a document titled Medicaid State Plan Fee-for-Service Payments for Services Delivered via Telehealth. Many of these links are available on the CMS Current Emergencies page, as well. For more information, please visit the reference below at aabc.com. Thank you for watching.